Pediatric registrar sitting his cubicle on the pediatric day unit. You are talking to Mrs. Morrison, mother of 17-month-old Callum. Background information: Callum is a previously fit and well 17-month-old boy. He was referred to the day unit by his general practitioner with a 5-day history of diarrhea and vomiting. His GP was concerned about his level of hydration and referred him to you for a second opinion. After taking a history and examining Callum, you feel that he is less than 5% dehydrated and arranged to admit him to the children's ward of rehydration therapy for rehydration therapy. While examining Callum, you note that he has periorbital and scrotal edema. A urine dipstick reveals that he has 4 pillars of protein, consistent with a diagnosis of nephrotic syndrome. His blood pressure is 72 systolic. So the task is please explain the diagnosis of nephrotic syndrome to Mrs. Morrison, right? So Dr. Rohel, you set the time and you are the role player as well, right? Okay, for you.
You can set the time.
Okay, no problem. So basically, the nephrotic syndrome, and you have to explain the diagnosis. It's not known case.
Mhm.
Okay, so Dr. Saib, when you start, I will start the time.
Okay. Hello, good morning.
Good morning.
I'm Dr. Rajpa, one of the exam candidate. I believe that you are Mrs. Morrison, Callum's mother.
Yes, I am Morrison.
Okay, how are you, Mrs. Morrison?
I'm fine, but Callum is not fine, doctor.
Yes, Morrison, Mrs. Morrison, you are right. So, Mrs. Morrison, that's why I have arranged this meeting to discuss about the Callum's condition with you. Is that right time to discuss that with you?
Yes, doctor. I was waiting.
All right. So, before I start, would you like anyone else to join us in this meeting?
No, doctor. You can start. No problem.
All right. All right. So, coming to the Callum's condition, Mrs. Morrison, as you know that he was unwell. That's why he was admitted in the ward. And I have thoroughly examined Callum. And during examination, we have found his swelling in body parts, including his eyes and his scrotal region. And along with that, we have done some test, including this urine dipping test, and we have found a protein in his urine that is showing that he is having a condition called nephrotic syndrome.
I'm not getting. What is this nephrotic syndrome, doctor?
No problem, Mrs. Morrison. So that's why I'm here to discuss this condition with you. So let me explain this condition with a diagram for your better understanding. Okay.
Yes, please.
Okay. So Mrs. Morrison, this is the normal kidney. All right. And
Mm.
there is the filtering part. What happens? This is the filtering part or the system of kidneys. Now, what happens in this condition? As you know, the normal function of the kidney is basically to help the body to get rid of the some waste, or you can say like some harmful products out of the body in the urine, in the pee. All right.
Okay. Okay.
Okay. And what happens in this condition? In this condition, due to the defect in this filter system, which usually releases the harmful substances, so due to the defect in this filter system, kidneys also leak some of the useful substance, including the proteins, out of the body in the urine. This is what is going on in Callum's condition. Are you
So,
getting my
doctor,
point,
why?
Mrs.?
Okay, I got that proteins are losing. Why it happen?
All right. So, Mrs.
What
Morrison,
is the reason?
they
Yeah, what is the
uh,
reason?
All right. So, Mrs. Morrison, there is not a single or exact reason. There are multiple causes of this condition, and due to some conditions or some causes of kidneys, some diseases of the kidneys, the bodies it can start leaking these proteins. So, there is not a single cause. There are multiple causes of the kidneys that can
Doc,
lead to this
doctor,
condition.
you mean to say Callum's kidney, he's having kidney problem? I heard that this is very bad if any child is having kidney problem.
I completely understand your worries regarding the Kalem's condition, but let me reassure that the children in this age, like the age of Kalem's, they develop the kind of kidney disease that is mostly the treatable one, and and that is also not the serious one in this age. Is that clear, Mrs.
Are you
Morrison?
sure, doctor?
Uh,
Are you
as
sure?
the all right, so Mrs. Morrison, the thing is that as he's showing this protein in his urine, and according to his age, so and the most of the common causing this kind of condition in these children, so they could be one of the possibility. But for the confirmation, I would we will run for some investigate some other test, and we will also like to see to look for any other underlying condition as well.
Doctor,
All right.
how will you manage Callum?
All right. So, regarding the management point, Mrs. Morrison, there are different strategies that we will opt for it. But for the management point, first of all, we aim to reduce this leakiness of the kidneys filter system. So, the most effective treatment is in the form of the oral tablet called steroid, as you may know
But
this
doctor,
name called prednisolone. Hmm.
steroids have side effects. I know
I
this
can
one, too much side effects.
Yes, Mr. Morrison, you are right. I can completely understand that you are very much worried regarding Callum's condition. But let me reassure that this condition, as with any other treatment, this drug may also have some side effects. But for that, we will keep an eye on him, on his condition, and regarding on the side effects of this drug as well. But let me reassure you that these side effects mostly develop when this drug, steroid, is taken for a longer time period, and in this condition, in children in this condition, they usually respond to this drug very well, and the treatment can be stopped when they
Doctor,
respond
I
this drug.
want I want to discuss with. Can you please refer me to kidney doctor? I don't want to start steroids. I want to discuss with
Six
kidney
minutes.
doctor.
6 minutes.
All right, so yes, your concerns are understandable, Mrs. Morrison. For that, I will make a referral to the kidney doctor, so that he will also explain this condition to you, and he will tell you to start this treatment as well.
So, doctor, he next month he is going to have some vaccination also. So, should I take this vaccination?
All right, so this point is very much understandable. So, Mrs. Morrison, regarding the vaccination, I would also tell you that you should not get him vaccinated with any vaccination without discussing with either me or either and without discussing with any doctor, because there are some vaccinations that can affect his condition and that can worsen his condition as well. So you just need to like first discuss those vaccination, and then you should go for those vaccinations.
Mm-hmm.
I hope that
So, what should
yes, Mrs. Moss.
what should I do at home for Callum?
All right,
Will
so
you admit
Mrs.
him now?
All right, so Mrs. Morrison, regarding this his condition, currently there is no indication for the admission. Like he can be treated very well at the home with some simple drug treatment. And regarding the precautions or the measurements that you should take at home, that you should daily check this protein in his pee by doing a simple dipping test. And also you can also keep a diary of this protein in his pee, so that we could have the record of like how much protein is coming in his pee. And along with that, there are some conditions, or if his condition worsens, or
So,
if he develop
when should
other
I
condition.
come to doctor? When should I contact you?
All right. So coming to this point, Mrs. Morrison, if he develops any serious illness, like if he develops fever or any dizziness, abdominal pain, or is there any altered bowel habits, then you should contact the GP, or you should seek the medical like intervention. Have you
Okay,
understood,
thank
Mr.
you.
Morris? All
Yeah,
right.
thank you.
All right. So, Mrs. Morrison, I hope that I have cleared all of your queries. But if you want to discuss anything further with me regarding his condition, then you can come to see me again. And I will also give you this some of the useful leaflets so that you can read those in your free time for this understanding of this condition. Okay.
Okay, thank you.
Welcome. So let me summarize that what we have discussed. Like Callum is having a condition called nephrotic syndrome, and I have told you
Time
the
is up,
medical
Doctor.
method. Okay.
Okay.
Okay. Thank you.
Uh, you have given all your my questions answers. You have given very rightly, but few things are very dangerous. I don't know. It's from my part only. Other peoples
Hmm.
can tell. Few jargons you have used, like urinary proteins. They are saying not should not use, but okay for me. I think okay. You have used urinary, and I was quite worried about the steroids. And the one thing you cannot refer to the kidney doctor,
Yes,
even
this
if I
was
am saying.
this. I was also not sure like what to do because who will start
There
the
are there are
steroid?
some there are some indications. Steroids you will start only. For referring to the kidney doctor, there are some indications. Without that indications, we are not referring in
Oh,
nephrotic syndrome.
okay, so those indications which are written in the guidelines. Okay.
Yes, one thing, and you cannot discharge the child. In Pakistan, we are doing on OPD basis, but in UK they are not doing on a OPD basis. They are keeping in the in the ward, starting this medicine because they are start also antibiotic treatment. And I think they are discharge
This
after
thing
5 days or
also.
something like this.
Okay, so this thing was also not written in any of the leaflet. I was also not sure regarding this thing, admission.
Yeah. So these two things was false. And steroids, you should tell about little bit about the side effects, and you should tell that weigh the benefits against the risk. And most children are, and you never you just not touch about the, when I asked you the causes, you told me so many causes, but you should tell that in the most children's and there are just minimal change in these filters. So we called it minimal change disease. They are usually treatable, as you said, but you didn't tell me what is the cause and why it is treatable.
Okay,
You should, I think you should use
did
this
not tell
minimal
this
change
cause.
disease.
Okay,
Yeah,
because
this
of
is
this
this will be
medical word.
better. No,
Okay,
this is minimal change. You will not use the minimal change disease. There are minimal changes in the filters. We called it minimal change disease, and most of the children very well respond to this treatment. Then I will ask you what I have asked. How will you manage? Then you can tell that the best, sorry, the main treatment is steroids, and additional to this we will give some medicine, antibiotic treatment to fight against the infections also. They are giving, this is written in the guideline. Always in the first whenever relapse or whenever this is the first presentation, they are giving the antibiotic treatment also. This is
Okay,
in the
so this
guideline.
is yes the guideline, but I think less than 2 years, so 17 months. So yes, it is
And
incomplete. But
17
anyways,
month, his
this is
Callum is
yeah.
17 months.
Hmm.
And about the vaccines, that was okay. uh, about the P test, yes, that was also okay. Just give him reassurance that the nurse will teach you how to measure the test at home. And other things, you used this word bowel, altered bowel habit. So this is also a jargon.
okay, bowel problems we can say.
Simple
Bowel
say
is
lose
jargon
poo
only, I
or
think.
throwing out.
Only bowel change. Other words are okay.
Okay.
Yeah,
I
bowel
use this
change,
word
altered
because of,
bowel habit.
okay, just to save the time.
So
Otherwise, I
these,
could mention this.
yeah, these are few things
Mm.
which I think we should not. Actually, there is a scenario where the mother is insisting that it's came in exam. Mother is
Yeah,
insisting
yeah.
that
That is. This is other scenario. That is a different scenario.
I want to meet
Mm.
kidney doctor.
Mm. No, no. That is a different
So
scenario. Correct.
because there is no indication, so no need,
Mm.
just give reassurance and each and everything.
Okay. Thank you,
Yes,
Dr.
yes.
Rahel. Anyone else has the feedback? Anyone wants to give a feedback?
Regarding this infection treatment, you should give this anti-bugs in all the children less than 2 years where it's written. I think it's
Yeah,
not written in
this
the guideline.
guideline they have written in the.
I think guideline. I read it, so I remember it. I'm not sure. I will make sure and send the group.
I will
Okay.
see. I have also this read from the guideline. I am
Mhm.
using just simply the kidneys are working in our body as a filters. They are filtering the waste products that come into the pee. But here in nephrotic syndrome, these filters are not working appropriately and causing the leak of substance called proteins. So the proteins are losing in the pee that cause the problems, swellings of the body, and child make the child at risk of getting infection.
Okay, thank you.
I'm doing like this.
So,
I don't
okay.
know this is good or not.
So
No, no,
actually, this is the
it's your approach is
complication.
okay.
So
Everyone
this
has
is the
their own
complication
approach.
of this
Mm.
disease. Getting infection is the complication, and for the complication, we will give antibiotic. Otherwise, treatment include the
No, no,
steroids, and yes, I
I
miss
will
this
check
water pills, diuretics for
1 minute.
this swelling.
Doctor,
But
Dr. Rasta, 1 minute. I will check in
hmm,
the maybe this
Okay, so we
also.
will check. You can send in the group, na? So
yes,
it
yes, we
is,
can discuss it later.
yeah, yeah, we can
Antibiotic
discuss it.
penicillin is given during the treatment until swelling.
If swelling is there, right?
If there is swelling, then you will be having nephrotic syndrome. Now,
Okay,
usually,
yes, now I get it. So if there is scrotal swelling and periorbital, there is risk of ascites, there is risk of infection in the scrotum, so they give the
because
prophylactic,
you
right?
have the high
Yes,
patient is prone to have the high infection, can have high
high
chances to
risk.
get infection because of
Yes,
the
yes,
I
right.
have written here, Dr. Bakar,
penicillin
Hmm.
medication.
until swelling.
Dr. Bakar, I am reading just this is one phrase only, just 1 minute. Prednisolone they are giving, and phenoxymethyl penicillin for pneumococcal
Penicillin, yeah,
prophylaxis.
until the
Presentation only.
swelling
No, no, not they
and
have
At
not
until
written
first
Dr.
until
presentation.
Irfan. They have
until
written
swelling.
only presentation. Only at the presentation. They have not written any
Yeah, yeah,
swelling.
until swelling written. If you see the guideline now, the nephrotic syndrome, you can see.
Yeah, this one, yeah, I understand. They are saying that until swelling is subside, you will have to continue.
Yeah,
Yes.
and the two reasons of penicillin. One is at presentation, other is if there is a, right?
Yes, they have written.
Okay,
I am reading from the guideline now.
okay.
Phenoxymethyl
So,
penicillin for pneumococcal
mhm,
prophylaxis presentation only. And if
mhm.
edema is upsetting to patient causing discomfort, add furosemide also.
If causing discomfort. Okay. So, Dr. Rashida, my feedback, you almost everything discussed by Dr. Rohel. So initially, you had little bit long sentence. Your first
Yeah, very long
writing the
sentences was there.
values. It was little bit long. You can make it in the chunks. And if you will ask the understanding at this point from the mother, it would be more appropriate, I think. The other thing, everyone has their own communication. It's up to you. You can use not the thing that someone can mind, but you are using the word "all right" too much, which I have
Hmm.
noticed. And everything you were saying "all right," so it's okay.
Yes,
But
should change. No, no, yes, you are right. Should change this
so
vocabulary.
just
Hmm.
yeah, so just this is
It
Sympathy
should not
was
be
very
repeated.
less, but I will not blame
mm,
Dr. Rashida because I was not also showing any I am too much worried. I was just asking the question. So why? Because I am having today fever actually. I don't want to come, so I was done this scenario. So that's why
Mhm.
I was not
Also,
showing
this
anything.
information giving, in information giving, how much we can show this empathy, like because this is like
No,
information giving.
this is also a bad news. This is also a bad news and information giving
Breaking bad
sometime.
Yes,
news. It
yes.
is
After
actually
Yeah,
that,
breaking
yes,
news.
after that, mother is all the
Mhm.
time inquiring, like, now what will
yeah.
happen
Then you
this,
will
like,
have to show,
Mhm.
like you in the previous scenario, you have done very beautifully that
because
scenario.
that
You
scenario
have,
was related to the empathy. Yes.
yeah.
Okay,
So here you can also show
okay.
little bit.
But yes,
But
Okay,
these
thank
today,
you.
two things,
today,
these were
Doctor
the
Doctor Vakar rightly said phrases were too much. Means to say this explanation was too much.
initial
It
explanation.
was right. It was right.
Initially, yes, first half of your
It was
presentation,
right. Not
you
bad,
can
but
make it in the
little
chunks.
bit long. Long explanations was there.
Mhm.
Okay.
Okay, so we will go for the second scenario. Irfan is the candidate, and Dr. Fatima is the role player. The second scenario, Dr. Irfan, are you ready? Dr. Irfan and Dr. Fatima.
Yes, inshallah, because I believe my system will not produce any hampering,
Inshallah. Today, no, today your voice is clear.
inshallah.
Okay. So still we have, I think, 13, 14 minutes, so we can finish it. So I'll just read the
Yes, we
scenario
have
for
20
you.
minutes. We had
Yeah.
20 minutes. You can continue.
Yeah. A pediatric specialist registrar
We
working
can
in a
cover,
busy
inshallah.
DGH. Inshallah. So you are talking to Mrs. Watson, mother of 5-year-old Joshua. Setting side room on the pediatric ward. Background information: Joshua is a previously fit and healthy little boy who has been admitted to your ward after having been unwell over the last 5 to 7 days. He has been diagnosed with the Kawasaki disease and has been commenced on immunoglobulin and aspirin. His mother is aware of the diagnosis but has asked to talk to you because she feels that she did not understand much of what was explained to her yesterday. The task is please explain the diagnosis, treatment, and management of Kawasaki disease to Mrs. Watson and try to answer any questions she may have. Right?
Okay.
So, Dr. Fatma, are you there?
Yes, I'm here.
Okay. So, Dr. Irfan, when you start, I will start the time for you.
Yes. Yes, start. Bismillah.
Yes, start. Okay.
Hi, good morning. I'm Dr. Irfan.
Good morning.
Yeah, one of the baby doctor taking care of the Joshua. You are what, Mrs. Watson, right?
Yes, doctor, I'm Mrs. Watts.
Mother of Joshua.
Yes, I'm mother of Joshua.
Yeah, today I'm here to discuss the condition of the Joshua. Do you want anybody to join this discussion?
No, doctor, actually, I wanted to talk to you. That's why I'm here and you can talk to
Yeah,
me.
most welcome. I'm here to help you, and I'm ready to
Thank
answer you all concerned. And what have been told you up till now about the Joshua? Do you have any information regarding Joshua condition?
you. Yes, doctor, I know that my son is
Can you hear
having
me?
some problem. Yes, doctor, I can hear you. And I know that Joshua is having problem for last five to
Yeah, okay.
seven days. He was having fever and he was quite irritable and there was some redness in his eyes and there was some other problems associated with this condition, and I know he has been diagnosed with Kawasaki disease and you are giving some medication to my son, but I know that this disease affects the heart badly, and that is the biggest worry. And other things I don't know in detail, so I want
Well,
you
I
to explain it,
appreciate your
please.
condition. You are facing through a hard time and difficult to bear all this condition. I'm here to help you and let you know about your concern. And as you told that this your main worry about heart, right?
Yes,
I'm right?
doctor. Yes,
Hello?
yes.
Yeah. Actually,
Yes, doctor.
your concern is quite valid. Yeah, it is more problematic when the treatment is late. It affects more heart. When we are giving treatment in time, we can reduce this complication, which is caused by the Kawasaki
Okay.
disease.
Okay. So you want to say, since
That
I
is,
have brought my child on the
treatment. Somebody told me about the treatment. Dr. Fatma, just आपकी आवाज कम आ रही है आपकी, just you just slightly.
since I have brought
Oh,
my child on the very next day of fever, so it means that he
yeah.
is not going to have any problem now, and he will be cured completely. His heart will be safe completely. You want to say this?
Yes, actually, the early the better, and we have a treatment that is called antibodies, which we'll call in the medical terminology immunoglobulins. If we give in time, we can minimize the complication caused by the Kawasaki disease affecting the heart. It's clear. I'm clear to you so far.
Yes, doctor.
Yeah. For this, we need to do echo to see how the heart is, how the heart status and its channels. Usually, it affects the channel of the heart and give the swelling if it is affected. So usually, when we start treatment, it minimizes these complications. And after the treatment, we usually do again the uh, heart scan to see this problem. I'm clear to you so far.
Yes, doctor. You are clear. But my biggest worry is
Yeah,
that
thanks a lot.
uh, my biggest worry is that uh, uh, after giving these medication he will be okay, and he will everything will be fine, and he will be safe completely.
Well, your concern is quite valid. Most of the children, when they are started early treatment with the antibodies and aspirin, they usually do well. But in order to make sure, we used to do, as I told you, after treatment, the heart scan. That will give us the exact answer of that problem.
Okay, doctor. So you want to give aspirin to my child. So I have heard that aspirin is
Yeah,
the one of the biggest cause of abdominal pain, and sometimes it causes bleeding also. Is it so?
yeah, you are right. I appreciate your knowledge regarding this medication. But in this condition, we used to see the benefits and side effect, and we have to balance. If we don't give this medicine,
Okay.
we can have, I'm afraid we
Okay.
can have more big problem than if we don't give. Yeah, I'm clear to you.
Okay. Okay,
Yeah,
doctor.
yeah.
So can you tell me what has led this problem to my child? My child, I keep him very clean, and he doesn't go outside. And so, what has led this condition in my child?
Yes, this is very valid concern. I'm here to explain you. This Kawasaki disease is a disease of preschool children, but can affect any age, and there is no cause
Okay.
and is recognized. But usually it is it is said that it is severe response to infection that results in the
Six
inflammation of the
minutes.
vessel.
6 minutes, Pan.
That, that is
Yeah,
my question.
as
My
you
child
know,
didn't have any
Joshua
infection.
has, yeah, that's why this is a
Okay.
response of infection, response of the body to the
Okay.
infection, severe response. That result, as you see, he has got fever and sore of the eyes, okay, swelling of the
Okay.
hands. So these things are the body response to the infection. I'm clear to
So,
you.
what do you think? Yes. So, what do you think? How long
Yeah.
does it will take, and my child will be okay?
Well, it's so early to say. After giving treatment, we will do the heart scan. We will see what is the condition and what information we get from the heart scan. Accordingly, we will
Okay,
put your
doctor.
child on regular follow-up and we will involve the doctor of the heart for this.
Okay.
Anything else you need to know?
Doctor, will my other child, who was staying with this Joshua, he's also 3.5 years old. He's also preschool. Is he going to be affected?
Yeah. I'm sorry, come again. I cannot get you to come again, please.
Will my other child be if affected with this condition because he was playing with the Joshua, and they were living in the same room and they were sharing their toys.
Yes,
Hello.
your concern is quite valid. Uh, this condition is not it will not transfer to one child to another child.
Okay.
Hello, can you hear me?
Yes, doctor, I can hear
Hello.
you. Yes, yes, I can hear you. Can you hear
It
me?
is not easily passed to others. Yeah, yeah, I'm gonna hear you.
Okay,
It is not if
I
infective.
got you.
It will not cause other children to get infected with this problem. Yeah. And secondly, this is not, as I told you, this is not infective. So this is anything else you need to know.
Okay, doctor, thank
Hello.
you. Yes, doctor, thank you. This is what
Yeah,
I
you are
wanted to ask.
welcome. So I will sum up the discussion. What we Yeah, yeah, you are, and I will sum up the bullet point of the discussion that we discussed. That Joshua has a condition called Kawasaki disease. For this, he did admission, and we will give the antibodies
Time is up, doctor.
that is immunoglobulins and aspirin. Before the treatment, we'll do the heart scan, and after that, we'll do a heart scan. And I will provide you
Okay,
the information leaflet, and I will provide the contact number. Thanks for your time out.
Okay, so thank you, Dr. Irfan. But I will just rejoin because within 1 minute it will
Yeah, yeah,
be
okay, no problem.
disconnected. So, Dr. Fatma, you will give feedback after rejoining. Okay.
okay.